Hello, I'm Dr. Arash Javanbahkt. I'm a psychiatrist and director of a stress, trauma, and anxiety research clinic at Wayne State University Department of Psychiatry. So I'm a clinician and a researcher. As a clinician, I treat a wide variety of people who have been through tough traumatic experiences, whether it's civilians, refugees, survivors of torture, human trafficking, and first responders. In terms of research, basically my focus is on understanding what trauma, stress, and anxiety does to the body and to the brain, and how we can use that knowledge to advance our treatment methods to better ones that can be more effective and help people reduce the impact of trauma and the stress on their bodies and their brains. For this, we are also working on advancing treatment methods, and part of my job also is, part of my work is involved in training the society and basically public education about matters that they might not know enough about. For instance, a lot of people in the public are not exposed to these aspects of the work of first responders. They have an imaginary view of what is the work of a first responder via TV or other stories, unless they have had family members, but a lot of times what they know is not enough. So as part of that work, I've been writing pieces about realities of life of first responders, whether firefighters or the police force. I don't need to come here to tell you that you have a unique job, which is very different, but sometimes we need a reminder. I have not seen many jobs and occupations that require a person to go from 0 to 60 very quickly, not knowing what they are going to face in a matter of minutes, and very frequently and often be exposed to horrible scenes of human agony and pain and suffering and trauma and stress and long hours of work and sleep deprivation and all the issues that come with the package of the work you're doing. And I say this because a lot of times we forget about the difficulties of our jobs because it becomes the norm, and we also forget about the impact that we are basically putting on the public by the sacrifices we are making, including what you're doing and how you're helping. A lot of people would not be alive if each one of you were not doing your own job. There are specifics to the kind of work of a first responder or firefighter here as well. I often say that for a veteran with PTSD, when they come back from the combat scene, they are now in a safe civilian environment. So these are different spaces and different environments and different contexts. So it's easy to come back to civilian life. But for a first responder, the same, even especially if you work in the same town that you live, your work and life environment overlap a lot. And it is difficult to differentiate these two aspects of what you're doing. For instance, for a lot of first responders, they might have had to go to a restaurant to save someone's life, do a CPR, go through a difficult situation. A lot of them, with the family, they go to a restaurant, they sit with their back to the wall, watching the exit, still having that work mind mentality there. Or a lot of first responders do not want to be around the crowd because this mind is in a state of threat detection, has to constantly screen for what may go wrong. So they don't want to be around the crowd, which limits their ability to function socially, let's say go to their kids' game. So it's often, as I mentioned, hard to switch off because the environment, the context, the town is the same thing, the same place. It's hard to after work switch off the firefighter, dispatcher, EMS, or police mind and become a civilian. So that drags the stress to the civilian life of the first responders. And sometimes work experiences are too relatable. I've very often heard from first responders that they really find it difficult to deal with the situation of CPR or death of a young person reminding them of their own child. And they find these experiences very traumatic. And sometimes this kind of relationship is hard to even identify and determine. For instance, I had a first responder who was a SWAT team member. And he basically, I encourage people to exercise and be active, and later on I will talk about why, but he found that during exercise, when his heartbeat would start going up, he would feel extreme level of anxiety, and we didn't know why. So Talking a little bit more, we realized that during some tough calls and tough missions, because his body was in that state of hyper alertness of fight and flight, the heart rate was high, and something horrible and terrible happened. Let's say, for this case, he was in the middle of a shooting. So for some unknown reason to the consciousness of this person, the unconscious mind had associated increased heart rate to danger, and every time he had an increased heart rate for other reasons, he would feel anxious, and that would limit his ability to exercise. And then this kind of chronic work-related exposure to trauma and stress can be detrimental on everybody. It's not just a matter of who's stronger or who's weaker. We are humans, and as humans, we have limited capacity to tolerate adversities. The scenes of like abuse, mutilated bodies, dead bodies, the unsuccessful CPRs, all these that you are exposed to on a regular basis can break a regular civilian, just one of them, and you get exposed to these experiences over and over. So data shows that about 20%, 1 in 5 of first responders at some point in their life experience full-blown PTSD, which is post-traumatic stress disorder with all the symptoms of anxiety, depression, flashback, nightmares, not being able to leave the house, all full-blown. So you can imagine a lot of other people, you can see colleagues and friends have some level of difficulty, at least with living their normal civilian life. And this is besides the depression, anxiety, panic attacks that can happen during a call, making you have to go sit in your car until it goes away, and then sometimes people trying to self-medicate with drugs or alcohol. And of course, a lot of times another side of fear is anger and aggression and irritability and those other negative feelings that can dominate a person's life because of the anxiety-provoking experiences. So what often happens in terms of when people have been experiencing trauma, and I'm talking about this to basically give an idea of what happens in the brain and in the body. Why is that important? Because when we know what is happening in me, it's easy. If I'm having a panic attack during a call, knowing what is causing this is important. And that's one of the things that we do when we provide help and treatment, to help the person know what is happening in me. And one of the things is that this is normal for a person to have a cringe response to a loud noise of a shooting gun. That is a normal human reaction. But then our brain, because that is very dangerous, associates anything resembling this experience or this sound to danger. For instance, for a lot of people who have been in shootings, including combat veterans or refugees or other first responders, 4th of July is a difficult time because those fireworks sound like a shooting gun, and I've had veterans drop on the floor as soon as they hear the sound of a firework. Or speaking of veterans, this view of an IED on the roadside makes sense to trigger a fear or anxiety response to prepare the person for protecting themselves and their colleagues. But then a lot of veterans with PTSD and trauma experiences find the roadkill terribly anxiety-provoking and stressful and scary. So kind of our animal brain associates a lot of other things in normal civilian life to danger when we go continuously and frequently through dangerous and painful experiences. So clearly there are ways to help, and I will talk a little bit more about how help can be offered, but there are also barriers to getting help for the first responders. One barrier is being able to know what is, first of all, what is happening. Is it wrong that I'm having panic attacks or high anxiety? Is it wrong that I get angry and my frustration tolerance is lower? Is it wrong that I have to drink a little bit more? Or is it wrong that I'm isolated a little bit? I don't want to hang out. I don't want to go to the parties. Or I don't have much like a mood for spending time with the family. Or is it part of my job? Is this that this job makes me like this? Or is this something that can be changed? Is this now the new me, or is this something that can be helped? So knowing what are the basically signs that there is need for help, and there are things that are bothering the person, let's say insomnia, flashbacks, that can be helped with So knowing those will help a lot for determining, okay, when do I need to get help and seek getting better. The other aspect is trust. Let's be honest, I've talked to a lot of first responders who have said, well, this academic doctor who has never seen what we are exposed to, they don't know much about my job, they don't know about the difficulties of our situations, how are they going to help me? And on top of that, talking about these issues like pains and traumas, it's very difficult to share these experiences with others and requires a lot of trust. So understand that could be part of it. If I open up myself to you, what are you going to do with all this pain and difficulties I've shared with you, and are you going to help or are you going to hurt me? So being able to build and develop that trust is an important issue. The other part is stigma. And the stigma can come from family, can come from colleagues, can come from the superiors, can come from anybody, or even my own perceptions of that, okay, now this is something horrible happening to me. A lot of time comes from people like me, the providers and those who help with the treatment, because sometimes psychiatrists or therapists kind of present this as, okay, now you have PTSD and this is the new label, a new person whom you are, and this is part of your identity, you're disabled for the rest of your life, which is not absolutely true. So trauma and overly stressful life can have impact on a lot of people. That doesn't say anything about how strong or weak they are, because there is genetics, there's previous experiences, there's proximity to trauma. There is like no two people experience the same painful trauma the same way. Even if we are near a fire accident where someone died, the way I saw it from that angle could be different than the way the other person saw it, or the meaning I associated with it, or a relative of mine that the victim was looking like. So these are all important aspects that can determine who may or may not be hit harder. I can talk a little bit later about. But at the end of the day, if one can overcome the stigma, these situations can be helped a lot. I remember a few years ago, National Geographic came here to do a report on our work with trauma and refugees, and I had basically U.S. Marshal with whom I'd worked before, came and did the interview with them. And one of the things he said that I never remembered was from the past, said the first time, said I had seen other providers and I was told that, okay, this is your new thing, new life that cannot be fixed and changed, and you got to live with it. But when I saw this doctor at the end of our conversation, he told me, okay, we're going to fix it. And just hearing that word helped me feel my feet, stand up and fight this, and now I have overcome it. So these are things that can be changed. Don't let someone make you think that, okay, this is a new label on the forehead for the rest of your life. So we can fix it. But if we don't, if these are just pushed under the rug and no help is provided and these are symptoms and problems are not addressed, well, in the chronic, in long term, my body is constantly on fight and flight system and mode, well, my heart rate is always up, my blood pressure is always up, and I will not be able to sleep. And in the long run, that can damage the cardiovascular disease, heart diseases, high blood pressure, diabetes, inflammation in the body and the brain, high cholesterol, obesity. These are the things that can linger if trauma is not addressed, and of course significantly damage a person's physical health at the same time while they're eating up the brain. And of course chronic pain is a common issue with trauma, unaddressed trauma in the long run. And in general, overall, our research from our lab has shown that people who have been traumatized and not addressed generally don't feel very healthy, even if objectively they are not as bad. So how do we help, and how can we address, and how can we help with reducing the impact of stress? So I'm not a pill pusher, so what we start is with helping basically with the lifestyle. What changes can we make in the diet? What are like a social life, family life, relationship with the spouse, sleep, things like that can be addressed and helped with in a realistic way. Of course, when we talk about exercise, and here is, if you wanted to look, there's an article that I wrote a few years ago, basically simply talking about simple lifestyle changes that can help. with improving mental health. When it comes to exercise, actually there's tons of research that shows regular exercise and workout improves blood flow to the brain, reduces inflammation in the brain, basically causes growth in areas of the brain which are affected by trauma and PTSD. So that can help a lot. And of course, I'm not naive to say, oh, it's hard to not understand. It is hard to go to the gym on a regular basis for a person with a very intense life and work style. But here, it's another article I've written recently. Basically, I explain how exercise helps with some basically adjustments in life that can help us put some level of exercise and activity in our lifestyle. And I promise I didn't choose that picture. I'm not that arrogant. The editor of the conversation chose the picture. Then there's the talking. Talking can help a lot and actually can help change the brain. Talking has two aspects. There are peer support programs, which are people who are like you, understand you, know what happens in your life, and because they have gone through it, and that can help basically figure things out when you come back from a rough call or rough run, and the same way you could help those others. And they can help better with understanding what happened, because sometimes when I'm in heightened emotional state, it's hard for me to be able to use all of my logic, so someone else can help me. And they can also help figuring out when you may need some more professional help. Guilt and shame are very often and very common feelings in anyone who has sustained trauma, whether, oh, how could I do differently to save that person or reduce that disability or help or save my colleague who was left behind. All these thoughts are common when someone goes through difficult experiences and trauma, and there are ways to help. We can help basically figuring these emotions and feelings out. A lot of times people, when trauma comes, the question is, why me? And then why did this one hit me hard? I've had people, firefighter for a couple of decades was working, and one day he saw a young man OD'd the same age of his own son, and he was hit hard that day. Why this one? Figuring out why that one can help a lot of time, can help with reducing the impact of trauma, basically creating the meaning. What's the meaning of these experiences? What meaning I have created for this, and how reasonable that is, and how we can come up with another or a more basically adaptive and realistic meaning of the experience to reduce the impact of these experiences on our mental health. Treatment, exposure is another way. Basically, when it comes to therapy, we can talk about the experience, or we can basically try to help the person overcome their hesitance in being in situations that, of the normal life that now they're finding difficult. Example, going to a restaurant and being able to have a dinner with the family. That's exposure therapy. What does that mean? We gradually develop a plan with the help of a therapist of slowly introducing the brain to that environment so it will relearn it's a safe place. Or there's a fire or police station that is hard to go to. And interesting is that we have a lot of research evidence that shows all these methods change the brain. The brain moves towards we can measure, we can scan the brain, and we see the brain moves towards more healthy style of its function. Example of the exposure, the same person that we talked earlier about that was finding his increased heart rate causing a lot of anxiety. When we figured out what was the problem, so we developed a plan. Okay, you go on a treadmill. I hate treadmill myself, but this first responder loved treadmill. You go on the treadmill for until your heart rate hits 100. You stop there and just be there until the anxiety goes away. Until the brain learns it's okay that your heart rate is 100 and nothing bad is going to happen. Next time 110, next time 120, and this is a picture he proudly sent to me after some time of practicing, which showed basically he had done a great improvement in terms of his ability to work out, and of course follows that increased energy and mental and physical health. We are also working on advancing our treatment methods with use of some cutting-edge technology. So when it comes to exposure to a lot of situations is difficult. Let's say you are hesitant to go to parties and be around people or be at a gathering. It's hard to create a gathering at a clinician's office. So in my lab, we have invented basically a method utilizing and using augmented reality, which is like you all have seen Iron Man. Basically you wear the goggles, you see the real life environment, then I can put virtual objects in the environment. So in that sense, people wear the goggles and we can create those scenarios of exposure for them on a scalable. So let's say, and I will show you a cool video. So this is the example of the technology where we start with we started with basically fear of spiders because that was this smaller prototype. The person wears the goggles, they see their surrounding environment, and we put a spider or tarantula in their living environment, in the real life environment, and I basically command the behavior of the tarantula. I see a 3D view of what the patient sees, and I just pick from drop-down menus and put those spiders and tarantulas in their environment. And interestingly, with this kind of phobia, everybody who received the treatment got the treatment response in less than 1 hour, one session of therapy, which was basically being able to touch this real-life tarantula. So we are expanding this technology to now, let's say, fear of dogs, where we put dogs in the environment and help people overcome their fear of dogs, fear of snakes. But when it comes to the first responders, we have been working on creating those real-life scenarios that make it difficult for a person to be around. Let's say here, the first responder wears the goggles and I see what they see and where they are, and I gradually create an environment and scenario of being at a party where gradually it warms up and there will be more people and will be more louder and there will be people behind you and you have to tolerate that, to basically prepare and practice for normal life situations that bother a person who's traumatized and now they're avoiding. So, and of course in the future we are hoping that this technology will understand, and this is a tough work because we are building this from the ground, some new technology that has not existed before. But the next stages would be basically utilizing training. Imagine wearing the goggles, being around the real neighborhood or a building where there are things happening and the trainer is basically making you go and fix things while you're on your feet. It's not that you're sitting on a chair, you're moving around and dealing with these situations. So bottom line, thank you for all you're doing, and there are a lot of ways to help with what might be bothering you or your colleagues. We are here to help and very excited about it, to serve those who serve us. Thank you.